Hi all, I am Dr. Janani working as Associate Professor in the Department of Pediatric and Preventive Dentistry. Today we will be discussing about a topic called Cariology, which is a very important topic in pediatric dentistry. Particularly we will be discussing the theories of dental caries in this video. So the contents are introduction, definition, classification of dental caries, and then we will be discussing each and every theory. Introduction. Dental caries remain as one of the most widespread diseases of mankind. Although there are effective ways for prevention of this disease, the unmet needs remain large in developing and developed nations. Caries is from the Latin word rot or decay. It is akin to the Greek word care, meaning death. So moving on to the definition, which was given by Schaefer, dental caries is a microbial disease of the calcified tissues of the teeth, characterized by demineralization of the inorganic portion and destruction of the organic substance of the tooth. Again, American Association of Pediatric Dentistry has defined caries as is a film-induced demineralization of enamel or dentin mediated by saliva. Next is the classification of dental caries, which is given in the book of Shobha Tandon. Based on anatomic site, it is occlusal caries, smooth surface caries and root caries. Based on severity, it is incipient caries, occult caries and cavitation. Based on the progression, it is again classified into arrested caries, recurrent or secondary caries, and then the radiation caries. Last is the classification based on chronology, which is early childhood caries, teenage caries and adult caries. Next, we are moving on to the theories of dental caries. So, the legend of worm, humoral theory, and then followed by vital theory, chemical theory, parasitic theory, acidogenic theory, proteolytic theory, followed by proteolytic chelation theory, sulfatase theory and autoimmune theory. So, the first theory which was proposed was the legend of the worm. The worm term was seen in the Sumerian text, which dates back up to 5000 BC. So, they have used plant sakil, which is bir, and oil. Even in Chinese and Egyptian history, they have used fumigation to kill the germs, and then they have done it by burning leeks and hyoscyamus. Moving on to the humoral theory, which was given by Galen, who is a Greek physician. So, he has explained that dental caries is produced by internal action of acid and corroding humus. He has stated that there are 4 humus, which are blood, phlegm, black bile and yellow bile. This theory was further followed by the vital theory. The vital theory was given by Hippocrates, Celsius and even Galen. So, they have mentioned that tooth decay originated like bone gangrene from within the tooth itself, followed by chemical or acid theory, which was given by Robertson in the year 1835. So, he has explained that teeth are destroyed by acids formed in the oral cavity. This theory was further followed by parasitic or septic theory, which was given by Erdl in 1843. So, he has mentioned that filamentous parasites are reason for the dental caries. This was further reinforced by Antony van Leeuwenhoek, who discovered the microscope. Under the microscope, he studied the dental caries and he has stated that microorganisms are associated with carious process. This was further followed by acidogenic theory, which was given by W. Bin Miller in the year 1889. This is the most accepted theory. They have stated that acids formed due to the fermentation of dietary carbohydrates by oral bacteria leads to progressive decalcification of tooth structure with subsequent disintegration of organic matrix. He also isolated microorganisms from his experiments and stated that many were involved in the carious process. There are 3 important factors which can influence tooth destruction in the process of dental caries. They are dietary carbohydrates, microorganisms and the acid. The limitations of this theory is it did not explain subsurface demineralization. They failed to justify rampant caries. They did not explain caries in impacted tooth and the phenomenon of arrested caries is not explained. Smooth surface caries is not accounted in this theory. Next, we are moving on to the proteolytic theory, which was given by Glottileb in the year 1941. So, they have proposed that formation of dental caries is essentially proteolytic process. Bacteria present produce hydrolytic enzymes and cause proteolysis, leading to the dissolution of organic substance. Microorganisms first invade the organic substance. I did admit that acid formation accompanied the proteolysis process. Yellow pigmentation of dental caries is because of pigment produced by the proteolytic organism. Further, the theory was developed by adding chelation, which is the proteolytic chelation theory. It was proposed by Schwartz in the year 1955. He stated that two processes are involved in caries: proteolysis and chelation. Chelation is a process involving complexing of ions into a complexing substance by covalent bond, which results in a highly stable, poorly dissociated and weakly ionized compound called chelate. Bacterial attack on enamel is initiated by keratolytic microorganisms, for example citrates and lactates. Chelates are always negative. So, the next theory will be the sulfatase theory, which was proposed by Pincus in the year 1951. So, he has said that bacterial sulfatases hydrolyzes the mucotin sulfate of enamel and chondroitin sulfate of dentin, producing sulfuric acid that in turn causes decalcification. The limitations of this theory is sulfated polysaccharides in enamel is very small and not readily accessible as a substrate for enzymatic degradation. So, this is highly unlikely hypothesis for the degradation of tooth enamel. The final theory of dental caries is autoimmune theory. Few odontoblast cells at specific sites within pulp of specific teeth are damaged by autoimmune mechanism. Due to this, the defense capacity and integrity of enamel and dentin in those specific areas are compromised and act as potential sites for caries development in future. I hope you understood this topic on theories of dental caries, and in the next video we will be discussing the cariology in detail. Thank you.